A Field Guide to Minor Mishaps by Brian Harper, performed by Dr. Frans Cronje. Adventurous travelers go to great lengths to prepare for serious medical emergencies, but it's often mundane and seemingly simple problems that interrupt trips or impair our ability to enjoy them. So prepare for minor annoyances and keep them from becoming major ones. Here are some examples. Sea bather's eruption or rash. It's often called sea lice, and sea bather's eruption is most commonly used to describe the itchy bumps that result from contact with so-called thimble jellyfish larvae, or the larvae of other organisms that have stinging cells called nematocysts. The time of onset and the location of the body can be helpful in identifying the cause. Sunscreen, sand, sweat, salt water, and sun can all irritate the skin. But stinging bumps that appear in covered areas of the body, especially at the cuffs or the edges of swimwear, during or soon after exposure, are more likely to be a sea bather's eruption. Treat the eruption or rash as you would any other jellyfish or coral sting. Rinse the area with vinegar and apply local heat to help relieve the symptoms if the itching or discomfort is severe. Wash the affected area and keep it clean and dry to promote healing. In severe cases, a doctor might prescribe antihistamines or cortisone. The only practical prevention is avoidance, and local dive centers know when these organisms are present. True sea lice are actually fish parasites, and they don't cause this condition. Water disinfection. Gastrointestinal distress from drinking contaminated water is generally avoidable. In places where the local water isn't safe to drink or is questionable, you'll want to have options for making the water potable. This may be very useful in certain parts of the world, in disaster situations, or when traveling in backcountry and taking water directly from lakes, springs, rivers, or streams. There are several factors to consider when deciding which method of water purification is most suitable for your situation, and the considerations include cost, time, and weight. Chemical treatments for sanitizing water are readily available at outdoor stores. The most common of these preparations include iodine or chlorine. Always follow the manufacturer's guidelines regarding the contact time that these chemicals require. Many of the available products only take half an hour or so to kill most microorganisms, but as long as 4 hours for others like Cryptosporidium. Colder water also may require longer contact times. The two downsides of chemical treatment are this delay before you can drink the water and, depending on the chemical, the taste. If you use powdered drink mix to flavor the water, wait until the water is safe to drink before adding the flavoring, because some drink mixes can interfere with disinfection. Boiling is a straightforward option, but you need adequate heat and a vessel which can be heated. There's no need to boil for any particular length of time. As long as the water reaches a full boil, no matter what the altitude is, you can be confident that all bacteria, protozoa, viruses, and parasites are dead. Boiling is time and labor intensive though compared to other methods, but it is reliable. If you're carrying fuel with you, it can also be space and weight intensive. Then there's filtration. This allows quick access to water, and most filters don't affect the taste. Many filters make use of small hoses and a pump, so the water can be obtained even from the smallest ponds, pools, springs, and puddles. Some are unable to remove viruses though, because it depends on the pore size. Some filters with pores that aren't small enough to remove viruses use chemicals to kill them. Small personal filters may be too time-consuming for larger groups, so multiple filters might be needed. Ultraviolet radiation is used widely to disinfect municipal water supplies, and as of about 10 years ago, lightweight handheld devices are available for personal water disinfection. The SteriPen is one of the first to hit the market and is still probably the best known. The device is turned on, dipped into the water and stirred for about a minute. It uses a lamp that emits UV radiation, which destroys the DNA of any microbes that are present, rendering them harmless to humans. UV disinfection doesn't affect the taste, and there's no danger from overexposing the water to radiation. Longer contact times increase the margin of safety, and the cost is the same as that of filters. Blisters. Prevent friction blisters before they occur by addressing hotspots, which is the precursor to a blister. Cover the hotspot with a commercially available product such as moleskin or medical tape to reduce the friction. Use the scissors to round the edges or tape before the application because sharp corners are more prone to peeling off. If a blister already appears, make a donut cutout of the moleskin or the tape layer, or mole foam, which is a thicker version, to reduce the actual friction on the blister itself. If possible, leave the blisters intact and resist the temptation to break them. Intact blisters heal more quickly. But sometimes it will be impossible to leave a blister intact. A hiker in the middle of a trip, for example, has little choice but to put their feet back into the boots and keep walking. In situations like these, it's appropriate and sometimes necessary to break the blisters intentionally. Use a sanitized needle or sharp blade and make a puncture or small incision near the edge. Make the perforation at the bottom of the blister if this applies, such as with a heel blister. This allows gravity to drain it. Add a little antibiotic ointment and cover it just as you would any other small superficial wounds. It's difficult to get tape to adhere to skin in wet environments, so you can use tincture of benzoin, which is a medical adhesive available at most pharmacies. Fish hooks. The general rule regarding impaled objects is not to remove them away from medical supervision. There are a few exceptions to this, which include small objects that are lodged in fingers or toes. Never attempt to remove a hook from the face or eye though. Rather stabilize it in place and get the person to medical attention as soon as possible. One proven method of fish hook removal is known as the string yank technique. How it works is as follows. First, tie a piece of fishing line around the curve in the hook. Then press the shank of the hook downwards towards the skin. The resulting levering should disengage the barb inside the wound. Use the line you tied quickly and snatch the hook out of the wound in the direction from which it entered. Alternatively, if the sharp end of the hook emerges from the skin or is very close to doing so, it's not unreasonable to push the hook through until the barb appears and then to snip it off. And then the hook can just be backed out. Always wash the area around the wound thoroughly. Puncture wounds are especially prone to infection, so keep an eye on the injury site for a couple of days following removal. Increasing stiffness or other signs of infection warrant prompt evaluation by a medical person or health provider. How about infected wounds? Scratches, insect bites, broken blisters, and other wounds are common in the wilderness. They are also more prone to infection than might occur at home. Sweat, dirt, physical stress, high altitude, an unvaried diet, suboptimal hygiene are all factors that can contribute to wilderness travelers getting infected wounds. The acronym SHARP, S-H-A-R-P, can help you assess whether a wound is getting infected. SHARP stands for S, swelling, H, heat, A, aches or pains, R, redness, and P, pus. Swelling, heat, aches, redness, and pus. Wounds that aren't infected, or are only minimally so, won't be particularly swollen or hot to touch, and they won't have associated deep tissue soreness and redness and pus will be minimal. Seriously infected wounds may cause stiffness and soreness, and red streaks may be visible. And the affected individual may have fever or a general sense of unease or malaise. With signs of serious infection, it is considered a medical emergency and in need of immediate medical attention. The best way to keep wounds from getting infected is to clean them thoroughly right after they occur, and then to dress and bandage them and to change the dressings daily. If signs of infection appear, re-clean the wound, apply moist heat, as hot as the patient can tolerate, about every 4 to 6 hours or so, and change the dressings multiple times per day. Give over-the-counter pain medications such as ibuprofen or paracetamol and promote rest and hydration. For remote trips, consider talking to your doctor about options for antibiotic therapy before you travel. If symptoms of infection do not respond promptly to available treatment, get the person to medical attention as soon as possible. As with major medical problems, preparation and prevention are the best methods of managing the small stuff. A proactive mindset will help ensure you aren't caught off guard by minor mishaps.